somebody maybe like Jeff up here teaching y'all, because my mother, I'm from Shreveport, and my mother at the bright age of 88 developed Alzheimer's, and she lived to be 94. And so I was a caretaker for many years, being an only child, so it kind of fell on me to take care of her. She was out at the Glen. And one of the first things that I noticed was that I did not recognize when the onset of Alzheimer's. And I used to go out and see her frequently, and I was at Willis Knight in Piermont at that time. I spent 32 years at Shumpert, and then I went to the Willis Knight system. And I was out there, and I would go out and see her at the Glen, and I would always try to balance her checkbook. And all of a sudden, it got to the point where I couldn't get the thing balanced, and she wasn't doing that much. And so, you know, I would just chew her out. I would say, Mom, why is this check in your book written with the wrong number? Or maybe she wouldn't put it in. And I think that was probably her first symptom of her Alzheimer's, and I didn't recognize it. Was she began to lose her mathematical abilities, and then I'd say, would you like to see some tapes of movies and everything? And I set that up for her, and I would come back and I would say, did you play the tape? And she said, no, I don't know how to do it. And you know, I would put the tape in, and I said, all you have to do is hit the power button and hit the little thing here with the arrow, and and you'll see a movie. But she couldn't do that. And so, you know, I really felt so stupid that I did not recognize the early symptoms in her of Alzheimer's disease. And then, of course, I took care of her remaining part of her life. And of course, it was unfortunately a downhill course, and it's really sad to see. And so at the last, Paulette had this in the newsletter. I want all of y'all to see this, because I think we're faced here with Alzheimer's. We have basically two things: the anatomical problems that go on, and what we can do, and these are the emotional focuses on the emotional things, and these are certainly just important as the anatomical. So my job today is to kind of go over some of the anatomical things that you know, this talk is for you, you know, the caretaker. And the American Heart Association and the American College of Cardiology came out with what's called Life's Simple 7. And I think we should all be aware, because these are the basics. And I want to give you a little story about basics. I think I can tell it, but I might do better if I just read it to you. It's the story of Eleazar Hall. It said, early in the last century, in the days when the great fleets of sailing ships went out of New Bedford to scour the oceans of the world for whale oil, the most famous skipper of them all was Eleazar Hall. Captain Hall took his vessels into more remote seas, brought home greater quantities of oil, and lost fewer crewmen in the process than any other master of his time. And all this was the more remarkable because he had no formal navigational training of any kind. When asked how he guided his ship infallibly over the desert of the waters, he would reply, well, I go up on deck and I listen to the wind and the rigging. I get a feel for the sea. I take a long look at the stars, and then I set my course. Well, one day, the march of time caught up with this ancient mariner. The insurance companies, and I call these the bean counters, we've all got them. The bean counters come in, who covered the ships of the Captain Hall's employers, declared that they would no longer write a policy for any ship whose master did not meet certain formal standards of education in the science of navigation. Captain Hall's superiors could understand this new rule, but they were at a loss to know how to approach the proud man whose life had been spent on the bridge, and to tell him that he must either go back to school or retire. After some consultation, they decided to meet the problem head on. 3 of the company's top executives waited on Captain Hall and put their dilemma as tactfully as possible. To their amazement, the old fellow responded enthusiastically. He had, it appeared, always wanted to know something about the science, and he was entirely willing to spend several months studying it. So arrangements were made. Eleazar Hall went to school, studied hard, and graduated near the top of his class. Then he returned to his ship, set out to sea, and was gone for 2 years. When the skipper's friends heard that he was putting into port again, they met him in an informal delegation at the docks. They inquired eagerly how it felt to navigate by the book after so many years of doing it the other way. It was wonderful, Captain Hall responded. Whenever I wanted to know my position, I'd go to my cabin, get out all the charts, work through the proper equations, and set a course of mathematical precision. Then I'd go up on deck and listen to the wind in the rigging, get a feel for the sea, take a long look at the stars, and correct my computations for error. So I like to read this to the medical students about learning the basics, going back to the basics in anything. And so today we're going to go through some of the basics where Life Simple 7, these are the basics. And I think this is important for y'all to know these, because this is to take care of yourself as well as your person who is your responsibility. And so it's really 2 sides to this. So there's the anatomical side and the emotional side, and they're both important. But I think that you should kind of recognize a little bit about, since this is we're talking about heart disease. Oh, and Paulette did mention that this is my home. We built this clinic. I bought this land from Dr. Wallace Brown, and we bought this land and the land behind us. And I had always wanted to build a heart clinic. And there was a beautiful home here. I think it was owned by Dr. Peachy Gilmer, who was a pulmonary doctor. And it was a beautiful home here. And in fact, right back here in the back parking lot, Dr. Colquitt and his wife were married back there because they had a garden back there. And so anyway, we bought this. Dr. Brown was a great surgeon here, and he used to have a shift of nurses. It would come at 7 in the morning, stay till 3. Another shift would come at 3 and go to 11. So Dr. Brown was a very busy surgeon. And so I thought he would always build a heart clinic here. But he never did, so I asked him if I could buy this property from him. And he said, oh, sure. So we ended up buying the property. Well, this home was here. We were going to have to tear it down to build this clinic. And so after we bought it, about 3 months later, I get this call in the middle of the night, and they said, your house is on fire. And I said, no, my house is not on fire. I'm here in bed. I'm sleeping. It's not on fire. And they said, this house that they were talking about, the house on Olive Street. And so, sure enough, it burned down. Well, I was kind of glad because we didn't have to tear it down. Well, the house behind it, it was a house that had been vacated, and it turned out there was a vagrant who was living in that house. And of all things, about 3 months after that, I get another call, your house is burned down. And I said, my house is fine. They said, the house that's in the back lot. So it wasn't too long after that these firemen came all dressed up and came to my office, and they wanted to know if I had any insurance on these buildings, because they thought I had maybe torched these buildings and was collecting the insurance. And I said, no, I don't have any insurance on the building. So we ended up building this clinic, so I can tell you we had about 20 years in here, and I can tell you so many wonderful stories that you would love to hear, but we don't have time for that today. So let me move to the Life 7 Simple 7 that the American Heart Association put out.
Excuse me, I'm gonna grab this.
Okay.
And I'll move these. Whenever you're ready for the next slide, I'll do that.
The first thing I would like to do is just to run through briefly a little bit about the anatomy of the heart. It's kind of like if you're going on a trip, you like to have a roadmap of where you're going. And so I wanted to just kind of present the heart to you to show you why you're doing things and show you the anatomy of the heart. This is a picture of the heart here. It has 4 chambers to it. The upper we call the atrium, right and left atrium. Lower chambers are ventricles. And I like to tell people that you can make this thing, it's a very complicated organ. But if you think of it like an automobile, it makes it simple, and when trying to explain diseases to patients, it's easy to think of it like it's an automobile. So an automobile has 4 doors as a rule, and so the heart has 4 valves to it. So let's see, we'll try the next slide. These are the 4 valves. This is the mitral valve, tricuspid valve, here's the pulmonary valve, and the aortic valve. In this picture, these 2 valves are closed, and these are open, and in this picture, the pulmonary and aortic valves are closed, and the mitral and tricuspid valves are open. So we're always trying to figure out, do the doors of the car open like they should? In other words, do you have stenosis of a valve, or narrowing of a valve? Or do you have insufficiency of a valve? Does a valve not close like it should, and does it leak? And so we call that insufficiency or regurgitation, and we name it by the valve. So if the mitral valve leaks, we call it mitral regurgitation. If the aortic valve is stopped up, we call it aortic stenosis. So we name the valves, and we get this mainly through cardiac auscultation. That's why we want to teach the medical students how to listen to the heart, because you can diagnose what valve is diseased and diagnose what disease they have. And of course now we have the echocardiogram, which has helped us a great deal. Okay, so we've got car doors. The next thing under the hood of the car is a fuel line system. Next slide. Here's our fuel line system, and this is the big thing right here. These are the coronary arteries, and one of these days, if I have a chance and I ever get close enough, I'd like to ask the good Lord why He gave us most organs in tubes. He gave us 2 ears, 2 eyes, 2 lungs, 2 kidneys. Just about everything comes in tubes. Well, we get 1 heart, just like we got 1 brain. And that 1 heart has these 2 arteries, the right and left coronaries, that give it blood supply. And this is what a normal artery looks like. It's wide open. The lumen of the opening here is wide open. It has 3 layers to it. The innermost layer is called the intima, and this is a muscle layer called the media, and this is an outside layer here called the adventitia. And this layer here is very important because that muscle contracts and relaxes, and that's why when you go out on a cold day, the media contracts and it cuts off blood flow to the skin so the body doesn't give up heat. So your nose gets real cold and your ears get cold, and it's because of this small vascular network that's scattered throughout the body that these vessels regulate our heat in the body. Well, these two arteries, the right and the left coronaries, at their takeoff here, we think of them as vascular trees, and at the takeoff they're about no more than 4 millimeters in diameter. Now that's really small. You know, at the takeoff they're about the size of a pin, and then as they go down into the heart muscle, it's just like a tree. They branch and they branch and they branch, and finally there's a very small network, a capillary network. And so it's the responsibility of those two arteries to feed that heart muscle. And if it doesn't, and you have a heart attack, school's out. That's it. One heart, and we got two scrawny arteries. So I'd like to know, why didn't the good Lord put 4 arteries in there? You could have done that. You know, if you're going to give us this complicated organ, we could get 4 or 6 or 8, whatever, more than 2. Well, starting when we're actually probably around 12 or 13 years of age, we start to lay down fat and cholesterol in our blood vessels. And as time progresses, this becomes more and more. And finally, as you notice here, we would say that vessel is approximately 70% stopped up. And so when it gets to that degree, blood flow is limited and people start developing symptoms. We call it angina pectoris, or your grandmother may have said angina pectoris. That's what the English like to say. And so it's because of inadequate blood flow to the heart muscle when it speeds up, that if you don't get blood flow to the muscle, we get symptoms of angina. And that's kind of a burglar alarm system for the body. You're supposed to, when you get that, you're supposed to stop. And we tell people the 3 E's, exercise, emotional distress, and eating, all have the common denominator of increasing the heart rate. Well, if you increase the heart rate, you've got to get more blood flow through the artery system and the coronary artery system. And if you don't, then you get symptoms. Now, one of the things with women was that we missed women for many, many years. We didn't realize, we always thought that heart disease was a man's disease. And it was because women had different symptoms of angina as compared to the man. The man would usually get heavy, tight, squeezing discomfort in the chest. And I hate to use the word pain because a lot of people would call it a tightness or a fullness or a heaviness or a squeezing. And it would tend to radiate up into the throat and jaws and then down the arm, especially down the inner surface of the left arm. And then when you stop and you let the heart slow down, the heart muscle doesn't need as much blood flow, the discomfort goes away. Women tended to have symptoms that were like, they would come in and complain of shortness of breath, or they felt like they were fatigued all the time, or they felt their heart was irregular. Sometimes those were what we call the angina equivalent symptoms. And so they were telling us that they had blocked arteries, but we didn't recognize it. So about in the 1990s, I would say, we finally woke up and realized that women have heart disease just like men, and women die more of heart disease than any other disease. In fact, heart disease, you know, when I look back on it, when I first started, heart disease was the #1 killer throughout the world. And as we look at it right now, cardiovascular disease is still the #1 cause for mortality. Cancer is probably second. And now, I guess we probably ought to throw COVID in there as third. But anyway, this is the problem, the coronary arteries. So a lot of the problems that we see with the heart, and this is where you're going to end up directing some of your attention, is trying to preserve this coronary system from stopping up. Let's see the next slide.
Okay.
Now the third thing under the hood of the car is a battery. And the heart has an electrical system. And here's the battery. We call this the sinoatrial node, or the SA node. And this fires an electrical impulse that spreads out over these pathways and makes the two upper heart chambers squeeze blood from the right and left atriums into the ventricles. And this impulse comes through a little receiving station called the AV node, down what's called the common bundle, the right bundle and the left bundle, into a so-called Purkinje system. So this electrical system, if we didn't have that, then, you know, it's like, how's your car going to go if you don't have a battery in it? And so this is what the EKG shows. The EKG is a record of the electrical system of the heart. So you see, really, y'all can all go teach cardiology now. It's just, you've got
just have pictures.
you've got 4 car doors, you've got a fuel line system, and you got a battery. That's all there is to it. So now we won't talk about the big books that you have to read about all the problems that go with this. And so today I'm going to try to touch just lightly on some of these simple 7 things, but let's see the next slide. I think I'm going to show y'all, tell you about this in a minute. We'll just let him stay up there.
Oh, okay. You want me to go back to it?
Yeah, if you want to. So I want to hit on some of the risk factors that y'all need to think about yourselves, to take care of yourself. And that's the whole idea of this Life Simple 7. Okay, so the first thing we talk about, one thing here is, the first one is a healthy diet. Now, I would tell you this, and I don't know whether you had the same experience, Jeff, but in medical school, we, as physicians, we don't really get taught much about diets. And so I would say most physicians, we know a smattering. We have a course called biochemistry, which is a killer. And we learn a lot of the chemistry of foods and everything. But now we have really good dietitians. And in fact, Louisiana Tech probably has one of the best dietetic schools that's around. It's a 4-year course, and the dietitian can sit down with you and tell you everything you want to know about all different foods, the good things and the bad things about food. When the doctors, as I say, and I speak for myself, when a person starts getting off into a diet, I'm pretty lost, because as I say, we're not really trained to help people that much with diets. I will say, we know that as far as the coronary arteries are concerned, that we try to get people to be heavy in their fruits and vegetables and the fibers, including cereals, foods with low glycemic index, eat non-saturated fats rather than trans fats or saturated fats, omega-3 fatty acids, which are found in fish and some plant sources, or you can actually get supplements of omega-3s, are important in the preservation of the coronary arteries. The Mediterranean diet, which is high in vegetables and fruits, is very good. And over at Willis Knight North right now, they recently I would say within the past several years, I was the director of the cardiac rehab program, and Willis Knighton decided to put in Dean Ornish's program for diet. And so about 5 people went out to California and got instruction on how to prepare foods and have healthy diets. And then they brought the chefs from out there over here, and so they prepared the meals here. So people that went through the cardiac rehab program would all be trained in the Ornish diet. Now, I'm so old that I go way back to liking things like chocolate. I mean, you gotta have chocolate every day, you know, and all the bad things. And so, so they cut out those things, and when I would sometimes fill in over there, when one of the doctors, I would leave Willis Knighton, my Willis Knighton rehab program out at Piermont, and then go over to North. They would fix an Ornish diet for the patients to try to teach them how to eat good food, and it's really almost a vegetarian or vegan diet. They cut out all meat. They cut out a lot of the dairy products, and so I guess if you grow up learning to eat those kind of foods the way they prepare them, it would be all right. But I just soon have heart disease than eat the Ornish diet. Don't y'all tell anybody I said that now, because we have a dietitian over there who is just outstanding. And so I would recommend for any of y'all, if you have trouble with your diet, consult a dietitian. And I'm saying skip the doctor and go to the dietitian. They know about foods, and they're good, and they can get you on the right path there. And that's very important, because the wrong foods plug up our arteries. Okay, second thing, smoking cessation. Boy, this is a real problem. This is probably our #1 killer. Smoke, the nicotine, let's go back to that little first slide. Nicotine, well, there we can, let's go to that one, Paulette. Nicotine has an effect on the media right here, and it constricts the media. So that causes a higher pressure within that blood vessel, and it tends to tear up the intima and the media, and that leads to cholesterol deposition. And so so cigarette smoking, as far as we're concerned, is a really bad thing, and that's nicotine in any form. It's whether you smoke it and inhale it, or whether you chew tobacco or snuff, or it doesn't matter how you get nicotine.
What about the vapes?
Beg your pardon?
What about the vapes? The vapes that kids are using nowadays, those vapors?
Oh yeah,
It's like cigarettes.
Yeah.
I keep trying to tell
I
them.
think I've forgotten the quantity of there's nicotine in there. But I will tell you this: nicotine is probably one of the worst addictions that a person can have. It's like alcohol, worse. I would say worse than alcohol. Wouldn't you think so, Jeff?
Yeah, they compare it to heroin, I think.
Yeah. It's so hard for a person to quit smoking, and so there's all sorts of trials, ways you try to get people to stop smoking, but it's very hard to get a person to stop. And I think of the story of a professor who was at the pediatric hospital in Houston, who was a heavy smoker. He smoked, I think he smoked 2 or 3 packs of cigarettes a day. That's a lot of cigarettes. There's 20 cigarettes in a pack. So that means if you're consuming 40 to 60 cigarettes, you've got a cigarette in your mouth all the time. And this professor became the head of the American College of Cardiology, and he was a 2-pack a day smoker. So he said, how can I be the president of a large organization, an international organization? The College of Cardiology is both United States and abroad. He said, how can I be president and be a cigarette smoker? So he went to a doctor in Beaumont, a fellow named Dr. Reeves. And Dr. Reeves told him, he said, okay, Dr. McNamara, the pediatrician, he said, I want you to buy a carton of cigarettes that you smoke, and I want you to smoke that carton this week. I want you to smoke that whole carton. The next week, I want you to buy another carton of cigarettes that has less nicotine in it, and I want you to smoke less nicotine and tar in it. I want you to smoke that carton of cigarettes that week. The next week, go and do another carton of cigarettes with a lesser amount. So what he was trying to do was to gradually wean him from nicotine, his desire for nicotine. And when it was over, he said he was so tired of smoking cigarettes that he was able to quit. So there's all sorts of little tricks, and he wrote this up in the American Journal of Cardiology for physicians to maybe try that on patients. But we also have drugs that we use. So you try non-pharmacological ways to stop, and you then have to go to maybe pharmacology, nicotine substitutes. So those are some help to patients. But I've had people tell me who have totally stopped, if they ever smoke one cigarette, just one cigarette, they're hooked again. It's like an alcoholic. They get their body craves that alcohol, and they never get over that sensation of craving nicotine. And so they have to really be careful. It's really hard for them. But from our standpoint, you know, most people think of cancer when you talk about nicotine and cigarettes. We think more in terms of artery disease. We see the heart attacks and problems, the vascular problems, way before we see the cancer. So nicotine is a big bad thing, and you know, the young people just don't realize it, because it takes a good while for nicotine to really produce atherosclerosis. It takes about 20, they talk in terms of pack years, about 20 to 25 pack years. So that would be, say that you average 1 pack of cigarettes a day for 20 years. Well, if you do that, then you're in the ballpark to have vascular problems. And of course, young people, they don't realize that. They start young. Their arteries are not, they're not having any trouble with their arteries plugging up at that time that they know of, or at least they're not symptomatic. And so it's hard to get the young people off. And like you say, the vapor, now, you know, they try different modes, but they're still going after that nicotine. Okay, another factor now is hypertension control. So we want to control our diet. We want to control the smoking. In fact, we want to stop the smoking entirely. And then the hypertension or high blood pressure is a big risk factor in coronary disease. People always wonder, well, what is high blood pressure? And I would like to just say, well, think of it like it's a garden hose. If you turn a garden hose on, you turn your garden hose on, and you get a normal flow of water out of that, That's an old physics formula that says that pressure is equal to flow times resistance. Well, if somebody comes and steps on the garden hose, they have reduced the lumen or the opening of that artery. So once again, as you close that artery down, you're putting a higher pressure that's banging the inside of the artery, which tears it up and causes inflammation. And that leads to cholesterol deposition. So, so hypertension is a bad disease from our standpoint to produce atherosclerosis. There are, of course, certainly things that you can do now. We know that too much salt in the diet tends to help raise blood pressure. We try to get people to exercise to keep their weight down. All of these are ways to control blood pressure without using medication. But in this day and time, you will find that there are tons of antihypertensive, we call them, medicines that work on that middle layer. They cause dilatation of that middle layer. It tries to overcome the nicotine's constriction of the blood vessel and dilates the blood vessel so that you get normal flow out of the artery. So you're trying to drop your pressure by reducing the resistance of flow. In other words, the constriction is increasing resistance in your garden hose, stepping on the garden hose. So really, blood pressure pills are really designed to knock the guy off the garden hose. You want to knock him off the hose so you can get the same amount of water out of there. So if you think about this, they told you in high school that pressure is equal flow times resistance. So our pressure goes up if you increase the resistance, if you want to maintain a steady flow. So the body wants to always maintain a steady flow. So it says, okay, I've got to get this blood to all the muscles and the tissues, so I'm going to kick the pressure up. So that's what it does. So we try to get people to, watch their blood pressure. A lot of people have blood pressure and don't realize they have it. So it's good to have an annual examination by a family physician who checks your blood pressure, because some people have high blood pressure. They have no symptom whatsoever. Now you say, what symptoms? And a lot of people say, well, I've got headache, or I feel, I'm having these headaches all the time, or I feel flushed, or I feel, I just feel bad, which is a complaint, a non-specific complaint, but people just feel bad with high blood pressure. So we try to reduce the blood pressure, and you want to think in your case, what is my blood pressure? You want to know. Now, when I got out of school, as I say, this was right after the Civil War, they used to say normal blood pressure was 140 over 90. The Heart Association has since changed that, and we now say that 130 over 80 is a normal pressure. So you want your top pressure, which we call the systolic pressure, to be no greater than 130, and you want your diastolic, or your bottom pressure, to be less than 80. So we try to keep people in that range now, and that has helped cut down on the incidence of coronary disease and stroke. One of the big problems with blood pressure is that people who get it, they not only get heart disease, but they get vascular disease that involves the arteries to the brain. And so you'll hear of a lot of people who have had some type of cerebral vascular accident. They have high blood pressure, and many don't know it. And many have it, but they don't control it. Some people will take their pills. We see this all the time. We give patients drugs to lower the pressure, and we get the pressure down, And then the patient thinks, oh, my pressure is normal, I'm gonna quit the pills. Well, in this case, if you quit the pills, the blood pressure goes back up again. So once you're on antihypertensive medication, you're usually pretty much hooked on it. You usually have to stay on a medication. And now there's tons of medications, and I won't try to talk about those, and they've got tons of side effects. And what works for one person may not work for another person. So treating high blood pressure is a real enigma for us. Okay, the fourth thing is abnormal lipids. Lipid means fat. So we're talking about cholesterol. So this is one thing that you want to ask your family physician to do. Ask your family physician to check a lipid profile on you. Now, lipid profile includes a total cholesterol. It includes the good cholesterol we call HDL, and it includes the bad cholesterol called the LDL. And I tell people the way to separate that is, think of H is healthy. HDL is the healthy, the good cholesterol. The bad cholesterol is the L, the lousy cholesterol. There's another one called non-HDL. That's a bad cholesterol. And then triglycerides. So triglycerides are affected mainly by the carbohydrate in our diet. So in other words, diabetics who have abnormal sugars, blood sugars, have usually very high triglyceride. The upper normal for triglyceride is about 150, should be not over that. The normal total cholesterol should be about 100. Your LDL cholesterol, the bad cholesterol, you do not want it over 100. You want it less than 100. And in people who have coronary disease or diabetes, we try to keep the LDL at about 70. And so, and then the non-HDL, which is the other bad cholesterol, you want it below 130. So you look at those values and, you think, well, some people say, well, I'm not eating that much cholesterol in my diet. And we know there's a disease condition called familial hyperlipidemia. Now that means that in the family, it's a family history where people tend to overproduce cholesterol. And of interest, my father had that. My father used to have cholesterols of 550. And think, we didn't want that over 100. And he formed little nodules on his arm. We call them xanthomas. And in those days, the doctors thought they were warts. And he would go to the doctor and they would burn these cholesterol deposits off. And of course, that was not the problem. They thought they were warts. He would come home and his elbows would be raw from these cholesterol deposits. And then they would reform, and then you have to have them burnt off again. Well, those are called xanthomas. So cholesterol deposition can be a familial thing. So you might ask yourself, well, how old should I be before I start checking my lipid profile? Well, I had one patient, and I'm going to say, there's no magic age. You look at a family. I had one boy who was 27 years old. He had a heart attack. He had real high cholesterols. I said, how many children do you have? He said, I have 3. He had 3 boys. I said, bring all 3 boys in. I want to check a fasting cholesterol on them. Turned out his 9-year-old son, his cholesterol was 360.
Mm.
His 8-year-old son was normal. He was about 80 something. His 5.5-year-old son was 320. So here are 2 boys. They were not overweight. They were not eating high cholesterol diets. They had inherited from their father the tendency for the cholesterol to be high. Now the dietitians hate me when I say this, but most of the cholesterol in the body is made by the liver. we need cholesterol. Most of your hormones, the basic structure of a hormone is built from a cholesterol radical chemically. And so we need cholesterol, but we need it in normal amounts. And so if the liver is overproducing it, which is what is happening in these familial hyperlipidemias, then the liver's going to keep on kicking it out. So guess what? Now most of y'all have heard of statins. Have y'all heard of Lipitor and statin? The whole list of statin drugs now. They in essence go to the liver and tell the liver, quit making so much cholesterol. We don't want that. And the statins have been a real bonus to us. And in fact, there's a lot of evidence that maybe the statins help in Alzheimer's disease. You know, it's been postulated that people who are on statins have maybe a lower incidence of Alzheimer's than others. So, so the statin is a great drug. Some people have reactions to it and can't take it, but I would say on the whole, it's maybe less than 10% of people are going to have a reaction to a statin. And the reaction that they have is like they've got the flu. They ache in their muscles and they ache in their joints. And it doesn't matter. And you can switch to another statin and try that. Same thing. So they're allergic to the basic compound of the statin. Now, since my father had this, I started checking my cholesterol. And at first, for many years, it stayed normal. And then all of a sudden, on a routine check, my cholesterol was up around, it was around, the total cholesterol was around 150. And so I thought, well, you know, there's been no change in my diet. There was no change in my exercise. My weight had stayed the same. And so I thought, uh-oh, here come the family genes. So anyway, I put myself on a statin. And I've been taking Lipitor probably for 20, 25 years. No side effects, 1 tablet a day, keeps my cholesterol low, actually well below the normal values. And so the statins have been a wonderful drug. And if you have any abnormality, you may want your doctor to look at you and look at your family history. Maybe a lot of people, you know, don't know from their family history that they had high cholesterols, because this was not known many years ago, that cholesterol was a big producer in the process of arteriosclerosis or atherosclerosis. So get your doctor, ask him. He when he draws a blood study, he's going to usually draw what's called a CBC, complete blood count. He's going to check your hemoglobin, your red cells, your white cells. He's going to draw what's called an SMA 12 or 18. That's checking your glucose. It's checking your BUN, which is a kidney function study, your creatinine, your calcium, your phosphorus, your electrolytes. But it's not necessary. It's not a routine SMA does not check the lipids. So when you go to see your doctor, go fasting and say, I want a fasting lipid profile in addition to whatever else you're ordering. Because you may be surprised. You may have no symptoms from it. You may have no family history, but that liver may be overproducing the cholesterol. Any of y'all on statins in here? Yeah. Any side effects?
Mm-hmm.
Very few side effects. That's unusual, Jeff. Usually everything will give somebody poisons them. It helps them one way and then it poisons them in another.
The orthopedics don't like them.
What is that?
I come from a line of orthopedics and they don't like statins.
Oh, they don't like statins. Really?
Or it's one of them. Maybe it's that. I might be confused.
What is it? Because of side effects?
Arthritis.
Yeah, Yeah.
Yeah, my husband's a runner and he didn't like being on
Yeah.
statins because it made his legs hurt when he was trying to train for a
right.
marathon.
And that's almost an allergic reaction. It's like an allergy to penicillin. So you are allergic to the statin molecule. That's why if you change around, it doesn't do any good. You still end up with the joint symptoms. But as I say, as a rule, very low incidence, and it reduces the cholesterol deposition in these coronary arteries. So I love statins. I think that's why I'm still here. If I had to start this a long time ago, I think my arteries would be plugged up. Okay, so let's see. Okay, physical activity. Now, regular physical activity is recommended starting in the early school years and throughout life. They're now saying that we should exercise 150 minutes a week. And I know that, as caretakers, you think, well, I don't have time to exercise. But just simple walking, if you can get out and walk for 20 or 30 minutes a day, get out and walk. That helps your muscle tone, it helps the joints, and it's good for the heart. It's a wonderful thing. And now, of course, as you notice, there's so many of these exercise wellness programs that are out there. And you can get on machines, treadmill machines, and all these various machines. And when you do exercise, think of it in two ways. Think of endurance exercise. So you get on a treadmill and you walk. You're sustaining the heart rate. You're making your heart increase its rate, and you're doing it for a period of time. Whereas if you lift weights or you do resistant exercise, we try to separate those, endurance exercise and resistant exercise. From a cardiovascular standpoint, we're not worried about the guy that's got the great big muscles and big pectorals and everything and looks great. It's the resistant exercise is not necessarily a cardiovascular exercise. So when you do exercise, try to stay at it. Do an endurance type program. And so most of these wellness programs have different things, different types of things where you sustain exercise. And so that's something that you want to try to work in, trying to take care of somebody with Alzheimer's. That's like having a newborn baby. You're watching them all the time. When can you get away? When do you have time to get away? But if you can get away, 30 minutes, go out and walk. Just go out and do a sustained exercise. Or get a home bicycle, exercycle, and get on that thing and sustain your heart rate with that. So some type of exercise where you keep the heart rate going. We try to actually get people to get their heart rate to about 70% of their maximum heart rate, which let's just say this would be, say, about 120, 125 beats a minute. Sustain it for that period of time, not stop and start. So in other words, people who play golf, 18 holes of golf, that's 5 miles. So they're walking, say, 5 miles. But guess what? They hit a ball, and if you're like me, you're in the woods, you're looking for the ball, and you walk to the ball, and then you stop. And it's a stop and start sport, so you don't sustain it. Now, I'm a tennis player. I love tennis and done it all my life. But tennis is a stop and start sport. You can play a long set of tennis or a long point, but then all of a sudden the point's over, and what do? you stop and you walk and get the ball. And then you come back and then you serve. Well, by that time, the heart rate comes down. So, although tennis, and especially if you look at Nadal, you'd say, man, that's a vigorous sport. It is a vigorous sport, but it's not a cardiovascular sport. So you want to try to do something that sustains your heart rate. And actually, they say in the United States, only 20% of the people in the United States achieve or do some type of activity program on a daily basis. So keep that in mind. Okay, weight loss. Well, that pretty much, that pretty much speaks to our population now. In fact, in the paper not long ago, well, this was several years ago, Shreveport was the #1 spot in the United States for obesity.
Wow.
Shreveport was #1. And then I think last year or a year before last, I saw we had dropped down to 5. Shreveport was the 5th place in the United States for obesity. Now, you say, what is obesity? They measure obesity by what's called the body index, and they call it the body mass index, or BMI. And you can do this by going on your cell phone, and all you do is you plug in your height and your weight, and it will give you a number. It'll tell you what your body index is. If your number is less than 14.5, then you're underweight. So 14.5 to about, well, they say 24.9, so you might as well say 25. So up to 25 is a normal body index. If you're from 25 to 30 on your BMI, that's called overweight. If you're over 30, that's called obesity. And if you look around now, not only are the parents overweight, the children are overweight. I mean, this is an epidemic. And of course, this leads to early diabetes, which I'm going to speak of, the last thing. You look around and you see a large mother and father, and look at their children. The children are overweight too. And so it's a real problem. And so I would ask you to, really look, just plug into your cell phone and see what your BMI is. Okay, and so the last thing is management of type 2 diabetes. Diabetes is, I guess, diabetes is probably, I would say, one of the worst diseases that we have. It affects the large blood vessels, so that we see people having strokes and heart attacks, but it affects the small blood vessels, the capillary blood vessels of the body, and that's why you see people having laser therapy, because the capillary bed to the retina is stopped up. It affects the kidneys. They get nephropathy. They get small vessel disease as well as large vessel disease. So diabetes is it's just a horrible disease. We had a speaker that came here talking about a drug, talking about heart disease. And this was a room full of doctors, and that's when they used to give them suppers. And you come and eat, and they sell you on a drug. Well, trying to sell you on a drug. Well, this guy said, how many of y'all think that diabetes is a risk factor for heart disease? So everybody raised their hand. Sure. He said, no. And we thought, where did this guy come from? And he said, diabetes is heart disease until you prove it's not. So that's a strong statement, but it's true. You'll find that a lot of diabetics have premature heart attacks and vascular problems. And obesity leads to insulin resistance and diabetes. And so that's why we want to try to change those things. So keeping your weight down, physical activity, controlling the blood sugar and the lipids, these all help in reducing the incidence of coronary disease. Now, I'm just hitting just the high spots. I'm just clipping the tip of the mountain. So I'd like to open it up. Well, I want to mention this. Paulette has these little brochures, and I think this is something that everybody, I don't know whether y'all seen this is a newsletter.
The newsletter,
Have y'all read the newsletter? I think you should look at this because in this, it talks about the caregiver, why attend caregiver support group meetings. And I'm just going to run over some of these. It says, to be able to say how you feel and have others understand. To be angry and others will not say you should not feel that way. To find help or how to handle difficult behavior problems. To learn that you cannot and should not be the only one responsible for caretaking for a loved one who has the disease. To learn where to go for help in caring for a loved one. To realize it is possible to laugh at some of the impossible, crazy things that happen during a day with a person living with dementia. To learn to stop trying to teach or reason with your loved ones, as I did with my mother trying to balance her checkbook, and instead accept the way that he or she sees things is very real to him or her. To discover it is important to have some time for yourself and not feel guilty about it. And that's what think of the magic 7 here, this life simple 7. Think of those and think about that if you get the spare time. Okay, to become aware of how much it helps to know you're not making this journey alone, and to discover that coping is easier with support and caring and understanding of others, with others present, of the others present. So these are some of the mental problems that we see with Alzheimer's. I was just touching on some of the simple anatomical things that you can do to help yourself from a cardiovascular standpoint. Now I'd like to open it up for questions to some of you.
You have one more.
Uh-huh.
You have one more slide.
Oh, yes. I was going to show y'all when I said exercise. That's what I want you to do. I actually went to that. I was in Madrid, Spain, and I took that picture. And my wife has been trying to get me to throw that thing away. And I thought, hey, that's a lot of energy being spent on that picture right there. But anyway, that's why I got that picture. You really don't need to do that. You really just, as I say, the simplest of all things is to walk. Yes.
I wanted just to tie all that in. We had a gentleman in one of our support groups who taking care of his wife for a number of years. And we had talked in the support group about the importance of caring for yourself.
Right.
How blood pressure, and you don't realize how that's being elevated, the stress that you're under. And he had a stroke. And when one of the ladies went to visit him, that was the first thing he said, well, you and Kelly kept telling me that we needed to take care of ourselves, you know, and so
Right.
we just get so consumed about trying to take care of that loved one, and we have
That's
to
right.
remind ourselves, you know, that we need to be checking our blood pressure and making sure that we're maintaining our own health.
He probably
the
had
best we can.
high blood pressure, didn't he?
Right,
And he didn't know it.
right.
Right.
I never went to the doctor himself.
Right, so those are important things for caregivers to make sure that you're going to your wellness checks, that you find a friend or a loved one that can stay with that person you're caring for and make time for those visits to be proactive in taking care of our own health.
That's right. That's right. You know, we don't think of these things, and of course, as a cardiologist, we preach these things every day. We're always dealing with this. One of the things that we had in our cardiac rehab program was a smoking cessation program, and we had a person that was hired to do full-time smoking cessation. I mean, and she had tons of patients, and of course she kept records of them and would bring them back and say, have you stopped smoking? And I saw a man the other day. This is an advantage of COVID. A man the other day, we have been trying to quit smoking for years and years and years, and he got COVID, and he lost his ability to smell and to taste. And he said, you know what? I don't smoke anymore. So I said, well, maybe that's one advantage of COVID.